Good evening, everyone, y buenas noches a todos. Welcome, bienvenidos to the 2022 National Hispanic Council on Aging's virtual awards ceremony and fundraising event. We're calling it Strengthening Communities, Creating Health Equity. This year, though, we decided to have a 2-day special because one day is just not enough for the recognition that all of our honorees deserve. So get ready to enjoy this year's ceremony twice as much with us. NHCOA, as you all know, has been the nation's leading organization dedicated to improving the lives of Hispanic older adults, their families, and their caregivers for more than 50 years. We're carrying on the tradition as each year we host this event that provides a safe space for us to celebrate our mission and all the work that benefits so many older adults and Hispanic families in the country. The ceremony is also an opportunity to give back and recognize the trailblazers who have worked tirelessly leading the efforts around the world to achieve these goals. And as you may know, this is also NHCOA's largest fundraising event of the year, and we'll be having a great giveaway. The theme for this year's annual ceremony is Strengthening Communities, Creating Health Equity. What inspired this year's theme was the life stories and realities that we got to hear from all of our focus groups from across the country, which underscore the injustices that so many people in our community face. Yes, the research we did on obesity, asthma, and the COVID-19 pandemic tells us a story of our community's resilience and challenges, but also the goodwill of people in our society who want to help and address health inequities, even empowering women to age in their best health and providing housing for older adults as well. However, we know our work does not end there. After listening to the struggles and challenges our community faces daily, we cannot stand aside and refrain from doing something meaningful. We have a duty and a commitment to work and assist them in any way we can. Despite all the challenges that the COVID-19 pandemic has put in front of us, we have been able to overcome them, proving that our society can withstand any adversity. We're resilient, powerful, and tireless. We can end all inequities in health and economics and strive for proper representation in our community. Together, juntos, we can move toward a better future for all of us. Thank you, gracias, for being here and sharing our drive and commitment. We have prepared a night to remember, filled with many honors, special guests, as well as incredible musical and dance performances. But before we start today, on behalf of the National Hispanic Council on Aging, we want to extend our deepest gratitude to our incredible sponsors, which through their support, we have been able to host this celebration for all of you today. Thank you to our sponsors, such as Biogen, Compassion and Choices, Lilly, Pharma, United Healthcare, Verizon, and others. We would like to start this evening with a very special welcome message from the President and CEO of the National Hispanic Council on Aging, our fearless leader, Dr. Yanira Cruz. Under her leadership, NHCOA has achieved great milestones, and through the year, it has successfully made a positive change in the lives of thousands of older adults in this country and members of the Latino community. Please welcome our dear friend, Dr. Cruz.
Good evening. Welcome to National Hispanic Council on Aging's Awards Ceremony. Bienvenidos a nuestra ceremonia de premiación. It's an honor to be here with you today to celebrate and acknowledge leaders and individuals doing so much good for our society. Today, we pause to acknowledge the health inequities inflicting our Latino community. Too many Latinos continue to not have access to health care, and a disturbing number of Latinos lost their lives to COVID-19. In fact, the mortality rate for Latinos has increased. Since the COVID-19 pandemic, cardiovascular illnesses are on the rise, obesity is on the rise, and diabetes continues to hurt too many members of our communities. Adult vaccination needs to increase among Latinos to fully enjoy the benefits offered by the flu, pneumonia, and COVID-19 vaccines. And we must also pay attention to social determinants of health, ensuring we have adequate housing, food, transportation, and access to the digital world. Environmental justice is a priority to protect the planet and also to protect our health. The air we breathe is intrinsically connected to the quality of our health. For example, it impacts the incidence of asthma, and having access to nature is life and health for all of us. We must remain active, vigilant, and civically engaged to protect key programs that reduce disparities and help all people age in dignity. We need to elect legislators who will protect Social Security, Medicare, SSI, and the Older Americans Act. We must also continue to advocate for better working conditions for paid and family caregivers. Many older adults can resume their activities of daily living because a caregiver is providing the necessary support for them, and it is crucial that we empower caregivers and give them the resources they need because they sacrifice so much for all of us. On behalf of the National Hispanic Council on Aging, we are grateful for all the support from partners and allies. And in particular, I want to congratulate this year's awards winners. You truly are agents of change. Thank you for all you do to make this world a better place. Together, we can make a difference. Please continue to enjoy the program. Thank you y muchas gracias.
Now let's welcome our special guest, Mr. Jorge Lambrinos, Chairman of NHCOA's Board of Directors. For more than 30 years, Mr. Lambrinos has been actively involved in the field of aging, coordinating programs and services for the benefit of older adults all around the country. He also has been named one of the top 100 most influential Hispanics in the U.S. by Hispanic Business Magazine. Please welcome, démosle la bienvenida to Mr. Lambrinos.
Good evening, and welcome to the National Hispanic Council on Aging Annual Awards Ceremony. Thank you for joining us this evening to honor and celebrate the trailblazers who work each day to make life better for all older adults. My name is Jorge Lambrinos, and I am the chairman of the National Hispanic Council on Aging Board of Directors. NHCOA is grateful for all the contributions that have been made to advance equity, especially those made by the individuals being recognized this year. The theme of our award ceremony during this two-day virtual event is strengthening communities, creating health equity. It is a fact that communities that have access to tools that allow them to advocate for themselves and their communities make for a more equitable America. This advocacy will create the atmosphere so everyone can age in dignity and in the best possible health. But there is more work to be done to achieve true health equity in our country. We at the National Hispanic Council on Aging are working along with our national and local partners to remove the barriers that prevent many people from aging well. With the help of these partners, we aim for health equity, greater economic security, better access to housing, and enhanced public policy. As an organization, we know this can be possible. Older adults are important figures in our society, as they are involved in politics, science, arts, and several other fields. For example, the most powerful people in the world, literally those individuals running the world, are over 60 and well into their 80s. we need to make the point of the importance of refocusing some of the efforts targeting older adults and shift our mindset and culture to realize what older adults are contributing to the world. Older adults are important, and their contributions, wisdom, and hard work are still relevant and essential in our daily lives. We must remember that the world is aging, and older persons are becoming a very important part of our society. It is vital that we recognize Social Security as a risk. We need to protect programs that allow older adults to age with dignity. Medicare, Social Security, and Supplemental Security Income are essential programs that must be protected. We need more housing. We have a housing crisis in our nation. The housing waiting lists for older adults are very long, and many of them end up homeless while waiting for shelter. Building more housing is critical. At NHCOA, we continue to advocate for the protections of valuable benefits, such as housing, Social Security, Medicare, and Medicaid. Access to health care must also continue to remain a priority, not only for those working in the field of aging, but for policymakers at all levels. Furthermore, we need long-term care support for older adults to age in place, in the comfort of their homes and in their communities, and prevent them from being placed in nursing homes. Now is the time to act. NHCOA recognizes the importance of making a positive impact within communities, opening new paths to help build a more diverse, respectful country that focuses on improving living conditions for Hispanics, and thus ensuring healthy aging. We can do it, but we must do it together. En la unión está la fuerza. United, we have power. Let us work united for a better health outcome for all our elders and for future generations. Before ending my remarks, I want to give thanks to all of our partners, sponsors, and to you for supporting our mission and work throughout the year. I also want to thank Janita Cruz and her excellent staff for all of their outstanding work throughout the year and for organizing this great event. Gracias, and enjoy today's and tomorrow's virtual awards ceremony.
And now, amigos, it's time to bust a move. Let's enjoy an amazing dancing performance by our friends from Ardiente. Our annual awards ceremony brings together people who share our commitment to improving the lives of our communities. Tonight, we are celebrating and honoring those who have been putting in the good work and inspiring us all year long. To kickstart things off, let's welcome our first presenter, Yarisa Reyes, Director of Diversity, Equity, and Inclusion Engagement at Alzheimer's Association, who will be presenting the Research Recognition Award. Welcome, Ms. Reyes.
Hi, My name is Jarisa Reyes, and I'm the Director of Diversity, Equity, and Inclusion Engagement at the Alzheimer's Association. It is my honor to present this year's Research Recognition Award. The recipient of the Research Recognition Award goes to an individual who has demonstrated a commitment to improving the health of diverse populations through research. This year's recipient is Dr. Mireya Diaz-Santos. She is a Spanish and English bilingual and bicultural neuropsychologist and an assistant professor in residence in the Department of Neurology with a dual appointment with the Department of Psychiatry and Behavioral Sciences at the David Geffen School of Medicine. Dr. Diaz-Santos is the director and founder of the Equity for Latinx Hispanic Healthy Aging Lab at the UCLA Easton Center for Alzheimer's Research and Care in Neurology, with a focus on prevention and early detection and diagnosis of Alzheimer's disease and related dementias in the Latinx community. Her area of expertise is the Alzheimer's disease and related dementia science of recruitment and retention by the implementation and sustainability of mixed method community-partnered participatory research interventions, transforming healthcare systems and academic infrastructures equipped to foster Alzheimer's disease and related dementia research, accessibility, and inclusion in the areas of brain health prevention and early detection of Alzheimer's disease and related dementia. Ladies and gentlemen, please acknowledge this year's Research Recognition Award winner, Dr. Diaz-Santos.
Muy buenas tardes, habla la doctora Mireya Diaz-Santos, and I am beyond humble and honored to be the recipient of the Aging Research Recognition Award this year by the National Hispanic Council on Aging. I want to thank everyone in the organization, the Alzheimer's Association, for the nomination. And just a few words, because I cannot even express my level of gratitude of how honored I feel, mostly because when we talk about health equity, as a Latina, Afro-Latina de Puerto Rico, first generation, all I have been wanting to do since coming to the States in 2008 was to serve my Latinx Hispanic communities. And as a neuropsychologist, I was always, trying to figure out how to make neuroscience, neuropsychology, a health equity not enterprise, but just to work with our communities. So it has been a long time coming. But we're here, and I am eternally grateful for this recognition because it gives me hope that we're moving towards a more equitable healthcare system for our older adults that are higher risk of Alzheimer's disease, dementia, and other related dementias. Por la memoria de mi abuela, Estrella, and she's the reason why I decided to move to the States and leave my whole family in the island of Puerto Rico, because I saw how difficult it is, and I firmly believe that equitable science could be the answer. It has been a huge journey as a fourth generation in the mainland. But I don't regret it at all. So que le quiero dar muchas gracias a todos ustedes, a mi familia, por todo su apoyo, a mi mamá, a mi papá, a mi hermana. I'm the oldest of four. And to their love and support, mis comunidades, las que me han abierto las puertas aquí en Los Ángeles, en Southern California, que han confiado en mí, en my community partners all throughout Southern California and within UCLA. Mi familia de Los Ángeles, que siempre están apoyándome aquí, porque yo estoy sola, pero nunca más. So I can continue saying so much more, but I'll end up with these words. These awards are, what it meant to me is that my work is worthy of science, that someone is always paying attention. So as a junior faculty, I don't take this lightly. I think that there's a lot of work, amazing work that we can do as community of scientists, advocates, social justice warriors para nuestras comunidades, and I hope that to always paying it forward with our younger generations, that you can do this work and we can do it all together. So muchas gracias por su tiempo, se lo agradezco muchísimo de todo corazón. Muchas bendiciones y I'll see you in person soon. Se me cuidan. Bye.
Now I want to introduce the Lifetime Achievement Award. The recipient of the Lifetime Achievement Award recognizes leaders who have helped to improve the lives of older adults, promote health equity, and build sustainable, healthy communities. This year's recipient is Dr. Maria Isabel Rodriguez, a tireless fighter for the right to health, equity, women's rights, and justice. She has been made a public health heroine of the Americas, which is the highest distinction awarded by the Pan American Organization of the Health and World Health Organization. In 1948, Dr. Rodriguez received her degree in medicine from the University of El Salvador, being one of the few women in El Salvador to graduate from that degree at that time. Very impressive. Dr. Rodriguez is considered a pioneer in the field of research and teaching in cardiovascular physiology. Throughout her professional life, she has been a promoter of profound reforms in medical education. She has led the sector transformation of her country towards a universal, fair, and high-quality integrated health system with a rights-based approach and based on the primary health care strategy. Ladies and gentlemen, please acknowledge this year's Lifetime Achievement Award to our trailblazer, Dr. Maria Isabel Rodriguez.
Agradezco infinitamente al Consejo Nacional Hispano Adulto Mayor por pensar en mí al otorgar el reconocimiento del logro de vida. Y digo por pensar en mí porque yo no soy solo la que recibo este premio. Este premio es para todas y para todos los que han colaborado conmigo, mejor dicho, con los que he colaborado yo también. Y somos un solo un grupo que no sé cómo ponerle el nombre. Pero los quiero a todos. Siento que los reconocimientos que estoy recibiendo ahora al cabo de 100 años de vida pertenecen a todos. Este consejo se dedica a mejorar la vida de los adultos mayores. Muchos se sentirán aludidos. Adultos mayores hispanos, sus familias y cuidadores con sede en Washington. Este consejo promueve, educa y aboga por la investigación, la política y las prácticas de las áreas de seguridad económica, salud y vivienda durante más de 50 años. Y siento decirlo, pero que muchos de los aludidos, los mayores, no nos hemos dado cuenta de la enorme labor que este consejo hace y quizás lo ignoramos, ¿verdad? Y yo quisiera ser portavoz de la labor que este consejo realiza desde Estados Unidos, pero que tiene grupos en cada uno de los países que siguen su labor. Hoy me honra al reconocer que las personas adultas mayores podemos y somos, y creo que todos se sientan unidos, ser productivos. Y que no siempre el retiro a los 60 años de una vida productiva es justo. Yo creo que es una de las injusticias mayores, ese cuento de los 60 años a retirarse, y particularmente las mujeres ya llegó a los 55, y quién sabe si no nos van a seguir rebajando. Entonces preparémonos para... hay personas, y yo me considero incluida en esas, que llegamos a la etapa de adulto mayor sirviendo al país. Podemos. Yo llegué a los 77 años a ser rectora de la universidad, y aún más tuve el atrevimiento de ser reelecta, de manera que ya no cuántos años tenía cuando fui reelecta. A los 87 años llegué a ser ministra de Salud, y luego después a los 92 años acepté, no sé si me van a decir ustedes que sinvergüenza, a los 92 años a ser asesora presidencial en educación y salud. Dicen que no lo hice mal. Invito a todas las personas, compañeras de esta vanguardia de personas mayores, que sigan aportando a la sociedad, que no se dejen expulsar de la población productiva, y que muchas veces hay personas a los 30 años o 40 algunos que ya no pueden seguir aportando a la sociedad ni en su campo de conocimiento. Y por eso agradezco nuevamente esta distinción, lo hago en nombre de todos y todas, y espero que se unan más a esta lucha, a este reconocimiento, y que no se nos expulse de la vida productiva. ¿Ya? Muchísimas gracias por este homenaje, lo hago en nombre de todas. Muchas gracias.
To present the Entrepreneurship Recognition Award, please welcome Mr. Alex Perilla, a member of NHCOA's Board of Directors.
Good evening, everyone. My name is Alex Perilla, and it is my honor to present this year's Entrepreneurship Recognition Award. This award goes to an individual who has demonstrated excellence, innovation, and commitment to the well-being of society by creating employment and economic development opportunities, especially for women and older adults, and by upholding environmentally friendly practices. This includes both for-profit and nonprofit entities. This year's recipient is Sheila Thorne, President and CEO of the Multicultural Healthcare Marketing Group, LLC. A native New Yorker, she has spent almost 3 decades designing multicultural marketing and education campaigns for the top 50 pharmaceutical companies in the world, with a focus on communities of color. A former teacher of foreign languages, she has worked on multicultural health education programs in many therapeutic categories throughout North America, Western Europe, and Latin America. Ms. Thorne is committed to quality healthcare for all, especially for the underserved and underrepresented. She has delivered over 300 keynote presentations on health equity and diversity. Sheila works regularly with nonprofit organizations, for-profit companies, and government health agencies. She teaches at several universities and has been published in several industry, trade, and consumer health publications. She has built coalitions that galvanize communities of color around important health and social justice issues. Ms. Thorne is passionate about her work to improve the quality and longevity of life for all, no matter what language you speak or where you come from. Ladies and gentlemen, with great pleasure, I ask that you join me in acknowledging this year's Entrepreneurship Recognition Award winner, Ms. Sheila Thorne.
I would like to thank the National Hispanic Council on Aging for this very special and prestigious award. I am so happy and so excited and so humbled to receive the Entrepreneurship Recognition Award for 2022. I stand beside the National Hispanic Council on Aging in their commitment to quality, excellence, innovation, and the well-being of society. I started my company in 2003, and I have been devoted and committed to improving the quality and longevity of life of all Americans, no matter what they look like, where they come from, or what language they speak. So this particular award is very special and near and dear to my heart because I stand firmly with the commitment of the National Hispanic Council on Aging to that end. And COVID-19 has glaringly illuminated long-standing inequities and injustices in healthcare. So I am particularly pleased to be recognized for my humble efforts to help all of those of color live a quality, better, and longer life. So thank you again, and I look forward to continuing my work along with the National Hispanic Council on Aging.
The night is getting better by the minute, but let's take a quick break from the awards to enjoy an amazing jazz band, Douglas Lira Band. an incredible performance. Now, let's continue with our next presenter, Dr. Mike Ibarra, who's the Vice President of Medical Affairs and Strategic Alliances at Pharma. Tonight, Dr. Ibarra will present the President's Award.
Good evening, ladies and gentlemen. I'm Dr. Michael Ibarra. I'm a Vice President at Pharma, and it's my honor to present this year's President's Award. The recipient of the President's Award goes to an individual I've had the pleasure of knowing for many years and who has shown a strong commitment to supporting policy and programs aimed at ensuring older adults and their caregivers of all backgrounds get an equal chance of success. This year's recipient is Michelle Kimbrough, who is a Senior Director of Federal Advocacy for Eli Lilly and Company, where she works to establish and maintain Lilly's relationships with national organizations serving communities of color, as well as with patient advocacy and health professional organizations in a variety of therapeutic areas. By identifying areas of mutual interest, Michelle aims to create partnerships that improve patient care. She joined Lilly in 2007 as a public affairs liaison, working with mental health patient advocacy organizations in 6 states. Prior to joining Lilly, Michelle worked in the nonprofit sector for over 10 years with an emphasis on mental health. She's worked with children, adolescents, and adults in a variety of inpatient, outpatient, and community-based settings. Michelle serves on the board of directors of the Greater Washington Urban League and of Choices Coordinated Care Solutions, a nationally recognized system of care program for youth. Michelle holds a Master's of Arts degree in Counseling Psychology from Boston College and a Bachelor of Science degree in Psychology from Indiana University. Ladies and gentlemen, please join me in congratulating this year's President's Award winner, Ms. Michelle Kimbrough.
Thank you so much. I am both delighted and honored to receive NHCOA's President's Award. I have had the pleasure of working with Dr. Yanira Cruz and her amazing team and board of directors for many years in my role at Eli Lilly and Company, and their commitment to advocating for older adults and their caregivers is unwavering and unmatched. Lilly is a proud member of NHCOA's Business Advisory Council, as we want to do our part to support policies and programs aimed at ensuring older adults and their caregivers of all backgrounds have a fair chance to succeed in our world today. As you all know, Alzheimer's is a relentless neurodegenerative disease, and the statistics of misdiagnosis in Alzheimer's are alarmingly high, particularly in Black and Hispanic patient populations. That's why it's so important that clinical trials reflect the diversity of those impacted by the disease, and is one area where Lilly is focused to help improve health equity. It's important that we understand how medicines may work for all people. If we want to confidently say that our treatments work for everyone, then we also need to see representation in trial populations. At Lilly, we are answering the challenge to reduce barriers by working to make clinical trials more accessible. In one of our latest clinical trials, we're trying a different approach that will hopefully improve diverse enrollment, called decentralized clinical trials. The goal of this approach is to reach a broader participant group and to maximize convenience for patients. Participants will complete many study activities via virtual appointments in a convenient location for them. We are optimistic that this approach will yield a higher participation rate among diverse clinical trial patients. Again, it's my pleasure and honor to work with the National Hispanic Council on Aging on these and other priority issues that affect older adults and their caregivers. I sincerely thank you for this award, but more importantly, I want to offer my cheers of appreciation for the leadership and team at NHCOA for their dedication and hard work on behalf of older adults. Thank you.
And now, to help us present the last award of the night, let me introduce Miss Irene Bueno, a member of NHCOA's Business Advisory Council and a dear friend of mine. Ms. Bueno will be presenting the Service Award for Caregiving. Welcome, Irene.
Good evening, ladies and gentlemen. My name is Irene Bueno, and as co-founder and partner at NBG, it is my honor to present this year's Service Award for Caregiving. The recipient of the Service Award for Caregiving goes to an individual who has shown extraordinary caregiving service that has been recognized at a national level. This year's recipient is Jason Resendez, President and CEO of the National Alliance for Caregiving. With the National Alliance for Caregiving, Mr. Resendez leads research, policy, and innovation initiatives to build health, wealth, and equity for America's 53 million family caregivers. Jason is a nationally recognized expert on family caregiving, aging, and the science of inclusion in research. In 2020, he was named one of America's top influencers in aging by PBS's Next Avenue, alongside Michael J. Fox and Surgeon General Dr. Vivek Murthy. Prior to joining NAC, Jason was a founding executive director of the U.S. Against Alzheimer's Center for Brain Health Equity and was a principal investigator of a Healthy Brain Initiative cooperative agreement with the Centers for Disease Control and Prevention. While at the U.S. Against Alzheimer's, he pioneered the concept of brain health equity through peer review research, public health partnerships, and public policy. Jason is from South Texas and graduated from Georgetown University. Ladies and gentlemen, please acknowledge this year's Caregiving Service Award winner, Mr. Jason Resendez.
Thank you to the National Hispanic Council on Aging and Dr. Yanira Cruz for this humbling recognition. As we sit here tonight, there are more than 9 million Latinos providing unpaid care for a loved one in this country. These are our brothers and our sisters, our tios and our tias, our friends and our neighbors. They often experience health and economic challenges because of the care they provide. When I think of them, I think of my mom, who raised 3 kids while working a full-time job while also caring for my grandmother who lived with multiple chronic conditions. She didn't know it, but she was a sandwich caregiver, a situation all too common in Latino households. Like most caregivers, her care was done out of necessity, but also out of a deep sense of commitment and love. So on behalf of my mom and the millions of caregivers like her, I am deeply honored to accept the Service Award for Caregiving from NHCOA. Thank you, NHCOA, for your work to build equity and opportunity for aging Latinos. Together, I know we can create a future where family caregivers thrive at home, work, and in life. Gracias. Thank you.
As you know, this is NHCOA's biggest fundraiser event of the year. We need your help to keep improving the lives of older adults, their families, and caregivers. To moderate tonight's fundraising session, please welcome Cindy Padilla, former chairwoman of NHCOA's Board of Directors.
Good evening, everyone. Cindy Padilla, former board chair for the National Hispanic Council on Aging. And it again is my honor and my pleasure to be with you tonight with the National Hispanic Council on Aging for our fundraising, our annual fundraising event. And before I get into a little bit more of some of our particular or individual programs, I would really like to show a video that really gives an overview, a highlight of all of the work that we're doing at the National Hispanic Council on Aging.
Since 1969, the National Hispanic Council on Aging, or NHCOA, has worked to ensure the well-being of Hispanic older adults, their families, and caregivers in the United States. We are a non-profit organization dedicated to serving our communities by reducing the gaps that prevents them from aging with dignity, such as a language barrier, access to transportation, and discrimination. NHCOA works nationally and locally with government, organizations, and experts in the field of aging to develop initiatives, work on public policies, and conduct research that aligns with the organization's priority: economic security, housing, caregiving, empowerment, and leadership development. Our goal also seeks to empower Latino older adults, their families, and caregivers to be their own best advocates, ensuring their well-being by providing them with the necessary tools that are adapted to their needs and realities. We are committed to ensure that our seniors can age with dignity and autonomy, which is why we have housing buildings that offer quality, safe housing exclusively for Hispanic older adults. We are constantly innovating to better serve our community, which is why we have renewed the facilities at Casa Iris, our headquarters in Washington, D.C., ensuring a recreational place for residents to enjoy and engage in different outdoors activities. Mental health is also an essential component of our work. During 2022, we have expanded our efforts to strengthen mental health in our communities. Thanks to the work of our mental and physical health experts, we have conducted art therapy, workshops, group and individual therapy, workshops on self-esteem, and outdoors events to promote physical activity, strengthening their self-confidence and nourishing their desire to stay active. Throughout the year, NHCOA has created different informational campaigns to raise awareness on issues of high interest to the Latino community, focusing on diseases such as influenza, cardiovascular disease, and diabetes that disproportionately affect our population. We have also worked to sensitize and motivate our community about the importance of participation in health research. We work tirelessly and advocate for our communities, minorities, and older adults to be included, valued, and represented in health decision-making. Our efforts to fight COVID-19 remain strong and steady, with informational campaigns that encourage vaccination and NHCOA's participation in different health fairs. We have continued our mission to reduce the percentage of unvaccinated Latino nationwide and put an end to this pandemic. Likewise, NHCOA seeks to be an agent of change through research, thanks to the contribution made by different national organizations who are committed as NHCOA in providing solutions to our community's health issues. We have deepened topics of interest to Latinos such as asthma and obesity. Our research is not only an informational resource, but a reliable and trustworthy resource for public policy making. We provide decision makers with the Hispanic perspective on different issues affecting communities, as well as real and practical solutions to address them. We continue to work hard to meet the needs of our Latino and aging communities. NHCOA's voice is paramount in making our communities count and advocating for a better future for all. NHCOA, sharing the best of us.
So yeah, wow, what a great video. It's just a lot of work that we're doing in you can see in Washington, D.C. and in Kansas and Los Angeles, Miami, just across the country. And we can't do this work alone. We have a lot of grant support. We have a lot of business support. I need to stop for a moment and thank our board of directors for all of their hard work and their commitment to guiding our work at the National Hispanic Council on Aging and our Business Advisory Committee. A lot of our work we do through our Business Advisory Committee, and we couldn't have the outreach and reach the people that we do without them. But I wanted to make sure that we emphasize tonight the importance and the value of you, our viewers, people watching our fundraiser and wondering is like, how can I get involved? How can I support the work of NHCOA? And so you can do that right now by following the link or in the chat at nhcoa.org/donate. So you can donate any small amount, a large amount, anything that you feel that you can give is really going to be supportive and go to great programs. And one program that I'd like to highlight is the nutrition program that we do. And nutrition is such an important part of our overall health and well-being. And I can speak from personal experience. My father recently fell. And when we went into the hospital, and unfortunately he had x-rays and he broke a hip. But one thing that had really made his recovery even more difficult is the fact that, he was not as nourished as he should be. We say, Dad, you need to hydrate, drink water, we're always having, and yet he doesn't do it. And so it really had an impact on his health and his well-being. And so nutrition is a huge part of older adults' health and well-being. And at NHCOA, we really spend a lot of time on our nutrition programs. We spend a lot of efforts on nutrition, and it's food distribution, it's education. It's also, really bringing our communities together so that they can share a meal. So nutrition and social, interaction. And we know that through the pandemic, social isolation was a huge problem affecting our older adults. And now that we're able to come together, still wearing masks or still with, some precautions, we know that we can come together with around a meal, and nutrition is just a huge part of what we do. And so now with this fundraiser, it kind of reminds me of an Aerosmith song, it's now or never. And we really need to do it now. We need your support. And we really would like to ask you to think about the things that are important to you. Think about nutrition and think about the older adults in your life, the Hispanic older adults, the minority older adults, and say, how can I get involved? And what we'd like to do, again, is ask you to support our work, and you can make donations of any amount at NHCOA.org/donate. And that is NHCOA.org/donate. So tonight is night one of our fundraiser, and we have a second part tomorrow night. We hope that you stay tuned and join us again. And tomorrow, we have some really exciting news about a giveaway that we would love to have you participate with. So with that, I'm going to say good night for our first night with our fundraising event. And again, hope to see you back next tomorrow night. Thank you.
A huge congratulations, felicidades to all of tonight's winners. Each one of you is working tirelessly to complete the invaluable mission of improving aging conditions and fighting for health equity from your own unique field. Don't forget that your efforts are impacting the lives of thousands in and out of this great country. Please keep working with the same commitment that has inspired us all and will continue to inspire generations to come. We thank you, muchas gracias, and we honor you. What a wonderful night filled with so much joy. I would love to give thanks to our sponsors once again, because without them, we wouldn't be able to do any of this. You are, of course, very special. Your support is invaluable for us all and our work. Muchas gracias. Before concluding today's first part of the ceremony, remember that as Cindy mentioned earlier, tomorrow we will have an amazing giveaway during the fundraising session. With your participation, you will be able to win an Apple Watch Series 8. Exciting. That's all we have for you tonight, but don't worry, no se preocupen. Our celebration continues tomorrow. There's more awards, more performances, and more surprises. So please don't miss the second part of NHCOA's annual awards ceremony, Strengthening Communities, Creating Health Equity, tomorrow at 6 p.m. via Facebook Live. Nos vemos, amigos. But before we say goodbye, I want to invite NHCOA's very own Director of Programs, Christine Perez. Ms. Perez will perform No Te Detengas, a poem by Madre Teresa de Calcuta. Thank you again for celebrating with us. Muchas gracias. Good night y buenas noches, amigos. See you tomorrow. Hasta mañana.
Siempre ten presente que la piel se arruga, el pelo se vuelve blanco, los días se convierten en años, pero lo importante no cambia. Tu fuerza y tu convicción no tienen edad. Tu espíritu es el plumero de cualquier telaraña. Detrás de cada línea de llegada hay una de partida. Detrás de cada logro hay otro desafío. Mientras estés viva, siéntete viva. Si extrañas lo que hacías, vuelve a hacerlo. No vivas de fotos amarillas. Sigue aunque todos esperen que abandones. No dejes que se oxide el hierro que hay en ti. Haz que en vez de lástima te tengan respeto. Cuando por los años no puedas correr, trota. Cuando no puedas trotar, camina. Cuando no puedas caminar, Usa el bastón, pero nunca te detengas.